Hello, my name is Jessica Venhuizen, and I'm going to be discussing my IRB research proposal. The research question is, how do vitamin D serum levels compare in adolescents first diagnosed with type 1 diabetes to healthy adolescents with no diagnosed autoimmune disease? The study hypothesizes that there is a significant difference in vitamin D serum levels at first diagnosed adolescents with type 1 diabetes compared to healthy adolescents. The proposed study will compare serum 25-hydroxy-D levels in adolescents first diagnosed with type 1 diabetes to healthy adolescents with no diagnosed autoimmune disease. Some objectives of the study include to examine if adolescent children are vitamin D deficient or insufficient at first diagnosis of type 1 diabetes, to determine vitamin D deficiency is more common in adolescents with the autoimmune disease type 1 diabetes versus healthy adolescent children. It's also to provide some additional recommendation of vitamin D supplementation in children to help prevent the onset of type 1 diabetes. Some goals for the research are to help understand the cause and effect relationship between vitamin D deficiency and juvenile onset type 1 diabetes. Also to understand more clearly whether vitamin D status is the trigger for type 1 diabetes or a consequence of the disease, and to provide additional recommendation for supplementation of vitamin D in children. Just a little bit of background on type 1 diabetes. It's a significant global health problem and it's increasing worldwide. It's a chronic autoimmune disease that usually manifests during puberty or early childhood. It's characterized by hyperglycemia, which is either caused by defects in insulin action, insulin secretion, or both. It occurs due to the destruction of beta cells, and it increases the risk of retinopathy, nephropathy, neuropathy, stroke, and heart disease. Vitamin D is a fat-soluble vitamin. It has two forms, vitamin D2, ergocalciferol, or vitamin D3, cholecalciferol. Its dietary sources are fatty fish, tuna, oysters, egg yolks, fortified foods, but just keep in mind that less than 5% of your vitamin D actually comes from dietary sources. Both forms of vitamin D, D2 and D3, can be ingested, but D3 is primarily produced through sun exposure to the skin. The vitamin D deficiency causes rickets in children. Rickets is when the child has failure of growing bones to mineralize, and then in adults, it causes reduced calcium and phosphate absorption, which leads to bone demineralization and osteomalacia. Some roles that vitamin D plays in the body are calcium homeostasis, and then it also has a role in the immune system, which we'll talk about. And just a little bit about the current research of vitamin D and type 1 diabetes. Hypen and his colleagues conducted a birth cohort study in Finland to determine whether or not vitamin D supplementation or deficiency in infancy could affect the development of type 1 diabetes in children. 10,366 live births were followed, and out of those, 88% were given a regular vitamin D supplement. 11.7% were given that supplement irregularly, and 0.3% were not given the vitamin D supplement at all. 81 children were diagnosed with type 1 diabetes with a median age of 14. Results indicated that the development of type 1 diabetes was associated with the low intake of vitamin D and also signs of rickets in the first year of life. Risk was shown to be reduced by 80% if the child had received at least the recommended dose of vitamin D. And it's thought that vitamin D inhibits the autoimmune reaction towards beta cells of the pancreas, and the impaired immune system function due to depressed vitamin D levels in infancy is believed to have a long-term effect on the immune response later in life. Another cross-sectional study that was conducted by Soren, they discussed the multiple risk factors of type 1 diabetes patients, the risk factors that they have for skeletal frailty, including associated vitamin D deficiency. The study was aimed to assess the vitamin D serum 25-hydroxy D levels in youth with type 1 diabetes from the northeastern United States, while examining the specific patient and disease characteristics on vitamin D status. The study concluded that there was excessive vitamin D inadequacy in youth with type 1 diabetes compared to the healthy control group that did not have an autoimmune disease. A matched case control study with Kotari National male and female children 16 years of age was conducted to help find the association between vitamin D and type 1 diabetes and also study the difference in levels of healthy subjects and type 1 diabetes patients. The study showed that vitamin D deficiency was considerably higher in diabetic children versus the healthy children. This research study matched the control group and the experimental group. It was 150 patients and 170 patients in each group. And then blood samples were taken to determine the 25-hydroxy D levels, in addition to a questionnaire that was related to the research study. Another similar study was conducted to determine the association between ultraviolet B irradiance, vitamin D status, and incidence of type 1 diabetes in 51 regions worldwide. Incident rates of type 1 diabetes were gathered for 51 world regions in addition to data and UVB irradiance. An association was found between low UVB irradiance and high incidence of rates of type 1 diabetes. Incidence rates actually approach close to zero in some areas worldwide with higher UVB irradiance, adding more support to the concept of vitamin D reducing the risk of the disease. And as we kind of talked about before, ultraviolet B irradiance is the primary source of circulating vitamin D and accounts for between 80 and 100% of all of our intake. And some information about our subjects that will be recruited for the study. We'll have two groups, an experimental and a control group. The participants will be entered into the cross-sectional study. The experimental group, when they are newly diagnosed with type 1 diabetes, that criteria includes within the last 2 months. And then the control group will be entered into the study during a routine wellness checkup. Both groups will be adolescent males or females in the age range of 10 to 14 years of age, and also within a normal BMI of 18.5 to 24.9 due to the association between obesity and vitamin D circulating serum levels. We want to take out that confounding factor that could affect the vitamin D levels. Using a G-Power calculator, the minimum sample size of 122 was determined. This includes 61 in each group, the experimental and the control. A research assistant or nurse will obtain the informed consent, and then the participants and families will complete the questionnaire, and the subjects will have serum 25-hydroxy D levels tested, and this will all take place in the medical facility in the pediatric office. Some risks and benefits to the participant. The risks are quite minimal, and they include a blood draw and then violated patient confidentiality. The blood draw could include problems such as redness, swelling, bruising, an infection at the site of draw. And then since it is a medical study, there's always the risk of violated patient confidentiality. We will be taking extra precaution in that area to limit that risk. And then some benefits to the study include the patients and families will be educated on vitamin D and type 1 diabetes. They'll have a knowledge of their vitamin D status. And then also any results found by the study will be reported to them. Privacy and confidentiality, since we're using human subjects, it will be in accordance with the Belmont Report. It will follow Health Insurance Portability and Accountability Act privacy rules, so HIPAA, documented according to the participating clinic's normal procedures. So however that clinic usually documents all of their medical information, it will stay in compliant with that. It will be accessed only by the involved researchers, and records will be kept online and password protected. This password will be changed every 2 weeks to assure confidentiality, and access is only granted by participating researchers. The identity of each person will be protected by a personal identifier number that's assigned to each participant at the beginning of the study. And methods. Research subjects will be recruited from 15 pediatric offices across the state of Montana. The subjects will be recruited between July 1st of 2020 and November 1st of 2020. This time period will help assure that the patients have received some sun exposure or have been able to receive some sun exposure prior to the study versus doing it in the wintertime when sun exposure in Montana is quite minimal. The data as well as the signed consents will be collected at the pediatrics office, as I said previously, and the serum 25 hydroxyvitamin D levels will be used to determine the vitamin D status. And as for a data analysis, diagnosis of type 1 diabetes will be in accordance with the American Diabetes Association. Once the minimum sample size is reached, assessment of data including anthropometrics, age, body mass index, serum 25 hydroxy D levels, regular dietary intake, and sun exposure will be analyzed. The vitamin D deficiency will be classified as serum 25 hydroxyvitamin D lower than 30 nanograms per milliliter, and optimum levels will be between 30 and 80 nanograms per milliliter. 25 hydroxy D serum levels will be measured with a direct competitive chemoluminescent immunoassay. And this is a pretty standard test to determine the 25 hydroxy serum levels. And then all statistical analysis will be performed using SPSS for Windows version 7.0. Data will be presented as mean plus or minus standard deviation or percentages when necessary. Using the continuous variables such as weight, height, BMI, and age, we will be compared using the Mann-Whitney U-test or a chi-squared test for categorical variables. Some limitations of the studies. It does not include a comparison to geographical locations where sun exposure might be more consistent year-round. Being in the northern states, Montana does have several months out of the year where sun exposure is minimal. Future studies could definitely compare geographical locations to incident rates of type 1 diabetes, showing if the exposure to ultraviolet B irradiance lessens the incidence rate of type 1 diabetes in adolescents. Also, a limitation might be a larger subject group, and then a study that also includes an intervention of supplementation for deficient subjects could be beneficial. So why should we continue research in the area of vitamin D and type 1 diabetes? There is a high prevalence rate of vitamin D deficiency in type 1 diabetes patients, and that has become very known. Patients have an added complication of an increased risk of frailty fractures associated with bone mineral density. Vitamin D has an important role in the immune system and is directly and indirectly related to insulin secretion. And there still is a debate on whether vitamin D deficiency is caused by the autoimmune disease, type 1 diabetes, or in fact, if it's just a triggering factor for the onset of the disease. So that wraps up my research proposal, and attached are the resources. Thank you so much.